Hello again. It's Chris back with you. So today I'm going to talk about FND, or functional neurological disorder. This is one of my newer diagnoses, and FND is basically in your brain, if you think of it as a software problem instead of a hardware problem. So it's a problem with your nervous system. Some point in time, my nervous system was triggered by an event, and so this can be several different causes. They're not 100% sure on what causes FND. So one thing they know is things like infectious illness can lead to it. People who have a trauma background are more likely to have it. Women are more likely to have it. People who have chronic pain, chronic fatigue are more likely to have it. And it's an intersection between neurology and psychiatry. It lies in both worlds. And so some of the symptoms are motor dysfunction, so this can be limb weakness, and in some cases even like full paralysis, tremor, and this can range from a mild tremor to like full body tremors, spasms, jerky movements, gait issues, so issues with walking, speech issues, sometimes issues with swallowing. There's also sensory dysfunction, so this can lead to numbness, tingling, pain, vision issues, crawling sensations. There can be also dissociative non-epileptic seizures. So these would look pretty close to the same as an epileptic seizure, so they're hard to distinguish. So often they will do testing for seizures to see what type of seizure it is. Memory issues, chronic pain, sleep disturbances, bowel issues, bladder issues, depression, anxiety. Like I said, they're not really 100% sure on the cause of this. It is more common in women. It is more common in people who have trauma backgrounds and have gone through a lot of stress in their lives. And so sometimes to get the diagnosis, it can be difficult. It would be done in conjunction with both neurology and psychiatry. And so this would be an MRI would commonly be done to rule out things like Parkinson's disease or MS. There was also other tests like Hoover's test for functional leg weakness, seizure testing, functional tremor testing. And it is complicated to treat because they don't know where it comes from, first of all. And second of all, because it lies in two worlds, and because in our North American society, anything that lies in the world of psychiatry is unfortunately given a lot less attention. And so there isn't a ton of research on how to treat this, and even doctors themselves either don't know this condition or don't really understand it. So a lot of people will think that like it used to be called a conversion disorder, so your body converting thoughts from your brain into physical manifestations. That is no longer the case. Like, they can see this on brain scans. This is not something that somebody has control over. They're not going, oh, I'm going to have a tremor now, or oh, I'm going to have a seizure now. There is no conscious effort being put forth on the person who has it. It is a nerve impulse that is happening. So that person feels that pain, or that tremor is there. And so it can be made worse by things like stress, right? Lack of sleep, those kind of things, which is sort of like it leads to those things and causes those things, and then those things make it worse. So it's, a vicious little cycle. Having migraines can lead to these happening. So some of the treatments are things like physiotherapy to be able, in some cases, for some people, it's actually to be able to walk again. Some people will lose their ability to walk or to talk or to eat. It can be quite severe. Cognitive behavioral therapy helps, and occupational therapy, speech therapy, other things like neurofeedback can help. So for me, once I got the diagnosis and knew that really treatment depends on the person who gets the diagnosis. So about 75% of people with this diagnosis never get better. And that is in large part because to get better, a lot of the onus is on the person who has the diagnosis, because it has that psychiatric component to it, and it is all about retraining your brain. So it is about getting your brain to stop sending those impulses, those nova impulses, to the parts that are maybe having the seizures or the pain or the tremor or whatever it is, and figuring out how to retrain your brain and your body. And that's why things like occupational therapy are so important. For me, I've started doing neurofeedback. So I use this lovely little headset here. And this is through, this is the Muse headset, and I use the Mind Lift. So it comes with a sensor, and then there's a whole program for neurofeedback. So I go on my phone every day for at least 20 minutes, and I do neurofeedback training sessions. So it's kind of like playing games, and it retrains your brain to be able to reduce your pain. And so for some people, this could completely get rid of their pain and actually pretty much cure most of it. For myself, because mine's complicated by other conditions I have, like Ehlers-Danlos and osteoarthritis and postural orthostatic tachycardic syndrome, Addison's disease. All of these other things that I have also come with complications. I fracture really easily, so I have fractures in my feet that never properly healed, so that causes pain. And then there's the FND on top of it. So for me, it's a little bit more complicated to know what comes from what. And so treatment with something like neurofeedback is amazing, because it has definitely helped, and it helps me control my pain. And I have not had a single seizure-like activity since I got my diagnosis and figured out that I can control this. And so I am figuring out how to control that, but it does take a lot of effort. And my tremor is in part from my POTS and from my Addison's and from my arthritis and stuff. So I have other reasons why I have a tremor, but when I get really tired or really stressed, that's where my FND comes in, and it will definitely make my tremors, my weakness, like my leg weakness and stuff like that I have from other conditions, worse. So for me, it's kind of layered into how to deal with it. And I've read a lot of papers on this, and one of the biggest things is that doctors don't give the news very well to their patients. And that is a huge part of why 75% of patients never recover, is because of how they're told what's going on with them, and that they're not given enough information to know how they can help themselves and how they can get better, and proper treatment plans are often not put in place. And because there is more females than males, we already know in the North American and in a lot of other places in the world as well, health system, women are not given the same treatment as men are, and women are often given a diagnosis and then very little follow-up with it. And when it has any psychiatric component, sorry, my dog's having a little nightmare, little whimpering sounds. And so when there's a psychiatric component to that, women especially are very dismissed. And so very little effort is been put into figuring out how to really properly treat this. Another thing that I am doing is working on this book, and this is called Unlearn Your Pain. And this is on a very similar, so the doctor on this calls it the mind-body syndrome, but it's basically FND. They're basically the same thing. So this is a workbook that you can work through, and it has like pages that you fill out, and you can do something like that to help. But the biggest thing is knowing that it's within your control for a part. A lot of it's not. Like the symptoms themselves are not within my control. They're not within anybody who has FND's control. But getting better is within your control, because there is no pill that you can take. There is no anything else. Like you can take, it often comes with migraines, which I also suffer from. And so you could take migraine medication, which I choose not to do. But you can take medication to treat some of those symptoms, but there is no pill for this. If you are suffering really badly from depression, you can take antidepressants, but they don't get to the root of the problem. The only way to get to the root of the problem is to put in the work to do the, I'm doing the workbook, I'm doing the neurofeedback, I'm doing therapy. So I have every single day I am doing work on this to be able to get better, and I have gotten a lot better. I've also stepped back from work to take a break, and the FND diagnosis is a part of that. I got a lot of other stuff going on. I have really complicated health. Anybody who's following me knows that. But this is something that you have to just do the important work for, and yeah. So thank you for listening to me talk about FND.